and welcome to Queen City Skin Podcast. This is your host, Dr. Elizabeth Roston, board-certified dermatologist, skin, nail, and hair specialist, and cosmetic expert. This is your place to learn about skincare, skin conditions, and the latest cosmetic techniques and services. Empower yourself with skincare and anti-aging knowledge for healthier, more beautiful skin and appearance. The information in this podcast is not for medical advice. It is for informational purposes only, and you should always consult with your doctor for your best care. Hi, and welcome to the Queen City Skin Podcast. This week, we're going to be talking about injectables and very specifically dermal fillers. So injectables include two categories: neuromuscular relaxers, which I refer to as relaxers. These are commonly known as Botox, although there's 5 currently FDA-approved relaxers to help us with lines of muscle movement and other things. You can listen to a previous podcast about that. But today we're going to talk about what is referred to as dermal fillers. And these are substances that are injected into the skin to restore youth and balance, among other things. And we're going to talk about how they're used a little bit and how we make our decision on which filler we use. But let me start by saying dermal fillers are not just here to fill in lines. That's really not how we use them. The first filler in the market was collagen, and that was back when I was a resident. And just after residency, we used collagen, and that kind of was to fill in lines. It was not a bulky filler. It didn't last long, and you had to be allergy tested. It just didn't stand the test of time. Currently, we have a lot of fillers at our disposal, and you need to go to an experienced provider so they can choose just the right filler for you. But let's talk about what fillers can do. I mentioned that they don't just fill lines. We use them to restore volume and contour in a face. We can use them to create lift. We can use them to create balance or correct an asymmetry in a face. They can hydrate the skin and restore a little bit of glow to your skin. And we can also use them as a biostimulatory agent to generate collagen, to renew the skin, and to help us with acne scars. So it's really more than just sticking a filler in. We have to look at the face and where the deficits are, where you have lost volume, where there might be an asymmetry, a loss of balance, and where we can create lift. We can create lift from fillers. The most common filler used today is hyaluronic acid fillers. There's a variety that we use, and the choice of that filler depends on what we're trying to do. So some of them are a little more bulky and a little more stiff, and they create better lift. So we might use them in the lateral face, for example, and even into the hairline to create lift. When you lose volume out here, it contributes to a downward drift of the structures. And by filling in with a stiff or bulky filler, we get a little bit of lift from it. We also put it in the temples, and we can use it under the eyebrows to generate lift there. And those generally go kind of deep under the skin. And then we have some that hold more water than others. And those are great in the chin and sometimes the cheek, where we really want to create some plump and hydration. We might choose one of those fillers. And some of the fillers are meant to go in lines that are more dynamic, like your nasolabial folds that crease when you smile. And some are meant to go near the skin surface, and some of them so near the skin surface I can use them to fill in a little small scar or a small wrinkle. So there's a variety of fillers, and the choice of the filler really depends on what we're doing. All fillers stimulate collagen to an extent, and this is a great way to treat lines and wrinkles in the perioral area, like the lip lines and the lower cheek lines, the dynamic lines. It's really amazing. We can use hyaluronic acid fillers for that. And we can use a type of filler that's now known as a biostimulatory filler. So one of the biostimulatory fillers is Sculptra or polyl-lactic acid. And we've had polyl-lactic acid around for a number of years. Polyl-lactic acid or Sculptra was initially FDA approved for the treatment of HIV treatment-associated lipoatrophy. And that was its initial FDA indication and use. But since then, it's been used for a variety of cosmetic applications. And it's really nice in the face where we're trying to create volume where there's not structure underneath. So kind of the cheek hollows, for example, it's very great for there, and sometimes in the temple, and we can use it in other areas. But not only can it generate collagen, in the process, via the biostimulation, it can make the skin look better. In 2021, 2022, we started using more and more of a filler called Radiesse, which is calcium hydroxyapatite. This can be used straight out of the vial or with a little bit of thinning as a bulky or structural filler in the face, like the cheeks or jawline. It's great for the jawline. I love it for men because it doesn't hold water like a hyaluronic acid filler. And in general, men, we want to create some volume in the cheeks, but they don't necessarily want the round, curvy, hydrated, puffy cheek of a woman. And so it's a great substance for that. But what we've been doing lately is what's called hyperdilute Radiesse. And that means we take a syringe and we will thin it with some numbing medication and saline. And the amount that we thin it has to do with your skin type. If you're very thin, I might decide to thin it 1 to 3 or even more. But the ideal or most common dilution is 1 to 2. And this is a dilution that's appropriate for me to spread underneath the skin. I describe it like I'm spreading icing on a cake or something. Just spreading it underneath the skin. This will do a couple of things. It will break apart some of the attachments between the skin and the underneath structure. These attachments, when you smile, for example, they crease the skin, and this will help kind of buffer that creasing, and it'll buffer some of the lines, and particularly on the upper lip. But it generates collagen. It increases cellularity, and what that means is having that filler in there, more cells are produced. New fibroblasts are made, and this has been shown scientifically. Fibroblasts are cells that we need to make collagen. So when I say I'm doing a collagen stimulating treatment with a laser or a light or energy device or a filler, I'm trying to wake up those fibroblasts, wake them up and say, hey, fibroblasts, I need you to make some collagen. Well, hyperdilute Radiesse has been shown to increase the number of fibroblasts, and then these fibroblasts start making collagen. We have a collagen stimulating biostimulatory filler, and I don't think we've seen yet what all this can do for us. We started it initially for acne scars, and it's just fantastic. And I've been doing it more and more for wrinkles, primarily in the dynamic lines around the mouth that crease when you smile, but also in the hollows of the cheeks. And it's fantastic off the face. So neck lines, arm creases above the knee, and sometimes loose skin on the abdomen. We use this hyperdilute Radiesse to stimulate collagen and a little bit of tightening. So this is a really powerful tool, and I'm very excited about it. And this is a whole new world. If you talked about what I'm excited for in the future of cosmetics, it's the pairing of these biostimulatory fillers with our laser light energy devices. And right now we don't know the ideal interval, but you can imagine if I inject a filler that's a biostimulatory agent, and it's gonna stimulate your skin to make new fibroblast cells, and these cells are going to respond to our laser light energy processes by generating new collagen, we just have a win-win combination. Now, what we don't know yet is the ideal timing. Should I do the biostimulatory filler 3 or 6 months before we do our laser? It's not known, and it may be equal to do it at the same time. Currently, what we like to do is to do it at the same time, because I mentioned I can dilute these with the numbing medication, lidocaine, so that the area that we treat is numb for your energy treatment, whether it be radiofrequency, microneedling, or Viva, or fractional laser. It's numb for that. So we've been doing a lot of that and very, very happy with it. Off the face, chest, neck, arms, legs, it's really amazing. It just takes a series of treatments to stimulate collagen there. So when people tell me they're afraid of fillers or they don't want fillers, I imagine they're talking about overdone, puffy cheeks in the mid-face and squished up eyes and altered contour. But filler that is expertly done does a wonderful job at restoring balance, contour, and symmetry to a face. It generates lift, and now we know we can really use it to stimulate renewal of the skin with collagen stimulation. So usually after talking with me, even patients that were very afraid of filler, they totally trust the process and we're able to generate fantastic results. I thought we'd talk also a little bit about who should do your filler. It is recommended that you go to a doctor that is from a core specialty, and that would be dermatology, plastic surgery, facial plastic surgery, or oculoplastic surgery. And these are physicians whose core focus is the cosmetic and aesthetic field. There's certainly well-experienced physicians outside the core, but generally if you focus on a physician within the core specialties, you're going to do great. There are a number of non-physician injectors, so-called nurse injectors. Some of them are nurses, some of them are PAs, some are not either of those, and their experience varies widely, and I always urge caution. Our nurse injector, Kristen, has trained directly under me for a number of years, and she still trains with me. She does filler with me, she helps me plan, we do it together. When she does dermal filler on her own, we review the case together, we agree upon a plan, and the other thing we do together, and I do alone, is I review my results and outcomes. By reviewing my results and outcomes, I can critique my own work and extend my expertise in the filler. So at this stage in my career, I am an expert in injectables, including injectable fillers. I can assure my patients that I spend a lot of time in training and learning from others and going to academic meetings and reviewing my own results and feedback from my patients. And that's how you become an expert in injecting filler. You don't become an expert by getting a job at a med spa and attending a weekend course. So you can get great results from filler, but those great results are dependent on the injector. It's not magic. It's hard work and expertise, but wonderful results can come from it. And I urge you to consider dermal filler. It's a wonderful part of any anti-aging regimen. Thank you for your participation today. We look forward to working with you again on Queen City Skin Podcast. Take care.